Um, a very good evening to you all. At the outset, I thank PSF, core team, to think of me and to have me here address you. Um, my story about myself and Helping Hand Foundation is all about networking. And I think I was reading the flyer which was there in the kit. One of the core purpose objectives of this forum, an NGO which is PSF, is basically to network, draw synergies for betterment of the professionals and the society. So let me, in the allotted time, quickly take you through my journey. I'm basically a product of HPS Begumpet, and after schooling, I did my engineering from OU, mechanical engineering. I worked in a non-engineering side, marketing and advertising, because that was my family business for a while before I went to US. I got into IT, that was around the Y2K time, and I joined Infosys Technologies in 2000. I initially worked in the US for a few years, and I moved back to Hyderabad from 2002 to 2014. I was in Hyderabad working for Infosys. So during my work in Infosys, we used to do a lot of CSR work as part of the company's initiative. And it so happened that on one occasion, we got a very peculiar request of a plumber who was working for us as a contract employee. His son required a surgery, which was costing at that time around 1.5 lakh rupees. It was a case of a brain tumor, and then it struck me that we should help this person, and I started talking to my colleagues, and I shared the details of that particular person's need on an email, and I shared my bank account credentials. So within no time, I could mobilize that money, and in fact, more than that. So that was the trigger point that I realized that this is something which we can do together, and the whole journey of this organization and initiative started at that point. So being a 5-day week in IT, I used to spend some time on the weekends, Saturdays and Sundays, in my brother's office, and this word of mouth that we are trying to help people who are in medical distress went around the city, and then people started approaching us. So it started on a very modest note in 2007, and very quickly we were able to raise funds, what you call crowdfunding now. Crowdfunding was done way back in 2007 on the same model, and the network of the donors or my colleagues who were in Infosys started expanding. So it was initially a group of 5, 10, and they in fact got in touch with their colleagues outside Infosys in other IT companies like Oracle, GE, Genpact, Cognizant, Microsoft. So and the network started spreading, and so it went hand in hand. We started getting more requests because we were meeting people, and we network also was expanding. So in 2007, I decided that this work needs to be done under an institutional banner, and we formed this organization called Helping Hand Foundation in 2007, and decided that we will focus exclusively on healthcare, because what we realized is that a lot of civil society organizations working in Hyderabad work on education, women's empowerment, so many other things, skill development, but there were hardly a few who were focusing on healthcare. And healthcare, I was a bit passionate about it, so we have remained focused on healthcare. Now, what is important for me to relay here in this forum is that till today, this organization the spine, the backbone of this organization's funding comes from those employees, those colleagues of mine who worked in the IT and who are still working. So they've been supporting us over a period of almost 1.5 decades. 2007 to now is almost about 15 years. So unrelentless support. The network has expanded exponentially. It went into other IT units, other non-IT corporates, and eventually I think we have over 5,000 members, email IDs in our database, who subscribe, who contribute, and who've been supporting us over these years. So what is important to understand is that networking is very important. We've all been endowed with good jobs, decent salaries. We all well settled from the discussions I've been hearing now today. We all well settled in life relatively when compared to others. So it's our duty, and as Mr. Jayashanjan also pointed out, that two things which caught my attention, voluntarism and empathy. These are two characteristics which will be important in your career progress, in your career path. So what I feel is that that as professionals, as law-abiding citizens, it's a duty on our shoulders that we give back to the society. And there is no better way than to network through forums like this, through groups like this, and support causes which are dear to you. It not necessarily be healthcare. There's so many things, so many people are working on. You can take that up and support it and also participate. That is also important. So let me also give you a perspective on what the challenges are today. See, being in a corporate world, we are used to working in comfort, living in comfort, generally, right? So being in the social sector, being on the relief work, I have had first-hand opportunity to see what pain is, what suffering is. I'm sure you also have an idea, but I would like to share that perspective so that we are aligned on one page, on the same page. As Mr. Jayashanjan was pointing out, that COVID disrupted lives, COVID disrupted a lot of things. It has affected the downtrodden and the vulnerable groups even further. I will speak more specifically about Hyderabad because our work is focused here, so I have a better sense of understanding of what happens here. So last 3 years have been very bad, especially for the daily wages. They've lost whatever savings they had. They've lost the sources of income. They've lost the small trade and enterprises they used to run, and they are struggling to come to terms with life. So there's a general struggle among the lower strata, economically weaker sections, post-COVID in Hyderabad, and in the urban space, especially urban slums of Hyderabad. Healthcare is one thing which is affecting all. Health is affecting all, regardless of caste, creed, stature, and across the board it is affecting everybody, especially non-communicable diseases like diabetes, hypertension, blood pressure, cardiovascular, cancer. These kind of problems are now quite widespread. So are no longer the diseases of the affluent, but it is affecting the middle class, lower middle class, the poor, even rural, even the tribal populations are getting affected. So in a country like India, what happens is that healthcare is dominated by the private sector, as you all know. Majority of the people seek services in the private sector, about 75%. And when they do that, what happens is that they spend money out of pocket. And when these people are from the lower economic strata, out of pocket expenses reaches a point that it pushes them into poverty. So as per the National Family Health Survey, of 2021-22, it points out that almost about 40 million people are pushed into poverty every year because of high out-of-pocket expenses. So that's the kind of challenge we have. And unfortunately, in a country like India, that two areas of public service, education and healthcare, are still not up to the mark. And that's the reason, as I said, there's a huge trust deficit, and then the private sector dominates. The trust factor in the public health system is still very low, and people, even if they can't afford, go to the private for their medical needs. And this puts a huge challenge on them. At Helping Hand Foundation, what we're trying to do is bridge this gap. We are trying to connect the economically weaker sections to the public health system by facilitating certain programs in the government hospitals, in the slums, and in different areas, so that healthcare is made affordable and accessible. So the message I'm trying to give you is that the present scenario is quite bad. It's quite pathetic, I would say. There is an economic downturn because of COVID, where daily wages are struggling. They have got health issues which are rising by the day. There's a huge cost attached to these medical need, the health problems, and all this puts them into a huge burden. Most of them borrow. Most of them sell their assets like jewelry, property if they have, savings if they have, if they kept it for the children's education or marriage, and it takes a huge toll. So what I'm trying to basically say is that the situation out there is quite grim, and it is our duty as citizens, as professionals who are well endowed with decent incomes and better lives, to give back to the society. And there's no better way, as I said, than to network and expand and help each other. I would like to conclude on this note, and in the kit which has been given to you, there is a small flyer of our organization and activities which is there, and there's a QR code at the bottom. And if you wish to be a member of our group, a network, not necessarily to give money, but just to even have updates from us, you can just scan the QR code, and you can upload your data, and we'll be happy to keep in touch with you, so that this network which I created 15 years back, I wish to expand that and have more new people like you joining us, so that the work continues. So with this I end. Thank you very much for giving me this opportunity.
Ladies and gentlemen, that was Mujtaba Askari, President, Helping Hand Foundation.